If you thought muscle weakness was just about getting older, think again. It could be ALS. ALS stands for Amyotrophic Lateral Sclerosis, a disease that hits the nerve cells in your brain and spinal cord. These nerve cells control your muscles, and when they get damaged, your muscles stop working. At first, you might notice your grip getting weaker or tripping more often. Over time, it gets harder to walk, speak, eat, and even breathe. This happens because the muscles you need for these actions no longer get signals from your brain. ALS doesn't have a cure yet, but there are treatments to help manage symptoms and improve quality of life. If you or someone you know is showing early signs, talk to a doctor. Symptoms. Symptoms of ALS vary from person to person. Symptoms depend on which nerve cells are affected. ALS generally begins with muscle weakness that spreads and gets worse over time. Symptoms might include trouble walking or doing usual daily activities, tripping and falling, weakness in the legs, feet, or ankles, hand weakness or clumsiness, slurred speech or trouble swallowing, weakness associated with muscle cramps and twitching in the arms, shoulders, and tongue, untimely crying, laughing or yawning, thinking or behavioral changes. ALS often starts in the hands, feet, arms, or legs. Then it spreads to other parts of the body. Muscles get weaker as more nerve cells die. And this eventually affects chewing, swallowing, speaking, and breathing. There's generally no pain in the early stages of ALS. Pain also is not common in the later stages. ALS doesn't usually affect bladder control. It also usually doesn't affect the senses, including the ability to taste, smell, touch. Causes ALS affects the nerve cells that control voluntary muscle movements, such as walking and talking. These nerve cells are called motor neurons. There are two groups of motor neurons. The first group extends from the brain to the spinal cord to muscles throughout the body. They're referred to as upper motor neurons. The second group extends from the spinal cord to muscles throughout the body. They're referred to as lower motor neurons. ALS causes both groups of motor neurons to gradually deteriorate and then die. When motor neurons are damaged, they stop sending messages to the muscles. As a result, the muscles can't function. For about 10% of people with ALS, a genetic cause can be identified. For the rest, the cause is not known. Researchers continue to study possible causes of ALS. Most theories center on a complex interaction between genes and factors in the environment, risk factors. Established risk factors for ALS include genetics. For about 10% of people with ALS, a risk gene was passed down from a family member. This is called hereditary ALS. In most people with hereditary ALS, their children have a 50% chance of inheriting the gene. Age. Risk increases with age up to age 75. ALS is most common between the ages of 60 and the mid-80s. Sex. Before the age of 65, slightly more men than women develop ALS. This sex difference disappears after age 70. Environmental factors such as the following have been associated with an increased risk of ALS. Smoking. Evidence supports that smoking is an environmental risk factor for ALS. Women who smoke seem to be at even higher risk, particularly after menopause. Environmental toxin exposure. Some evidence suggests that exposure to lead or other substances in the workplace or at home might be linked to ALS. Much study has been done, but no one agent or chemical has been consistently associated with ALS. Military service. Studies indicate that people who have served in the military are at higher risk of ALS. It's not clear what about military service might trigger ALS. It might include exposure to certain metals or chemicals, traumatic injuries, viral infections, or intense exertion. Complications. As the disease progresses, ALS causes complications, such as breathing problems. Over time, ALS leads to weakness of the muscles used to breathe. People with ALS might need a device such as a mask, a max ventilator, to help them breathe at night. The device is similar to what someone with sleep apnea might wear. This type of device supports the person's breathing through a mask worn over the nose, the mouth, or both. Some people with advanced ALS choose to have a tracheostomy. This is a surgically created hole at the front of the neck leading to the windpipe. A ventilator may work better on a tracheostomy than on a mask. The most common cause of death for people with ALS is breathing failure. Half of people with ALS die within 14 to 18 months of diagnosis. However, some people with ALS live 10 years or longer. Speaking problems. Most people with ALS develop weakness of the muscles used to form speech. This usually starts with slower speech and occasional slurring of words. It then becomes harder to speak clearly. This can progress to the point that others can't understand the person's speech. Other forms of communication and technology are used to communicate. Eating problems. People with ALS can develop weakness of the muscles involved with swallowing. This can lead to malnutrition and dehydration. They are also at higher risk of getting food, liquids, or saliva into the lungs, which can cause pneumonia. A feeding tube can reduce these risks and ensure proper hydration and nutrition. Dementia. Some people with ALS have problems with language and decision-making. Some are eventually diagnosed with a form of dementia called frontotemporal dementia. Diagnosis. Amyotrophic lateral sclerosis, known as ALS, can be hard to diagnose early because it can have symptoms similar to other diseases. Tests to rule out other conditions or help diagnose ALS might include electromyogram, EMG. A needle is inserted through the skin into various muscles. The test records the electrical activity of the muscles when they contract and when they're at rest. This can determine if there is a problem with the muscles or nerves. Nerve conduction study. This study measures your nerve's ability to send impulses to muscles in different areas of the body. This test can determine if you have nerve damage. EMG and nerve conduction studies are almost always done together. MRI. Using radio waves and a powerful magnetic field, an MRI produces detailed images of the brain and spinal cord. An MRI can reveal spinal cord tumors, herniated discs in the neck, or other conditions that might be causing your symptoms. The highest resolution cameras may sometimes see ALS changes themselves. Blood and urine tests. Analyzing samples of your blood and urine in the laboratory might help eliminate other possible causes of your symptoms. Serum neurofilament light levels, which are measured from blood samples, are generally high in people with ALS. The test can help make a diagnosis early in the disease. Spinal tap, known as a lumbar puncture. This involves removing a sample of spinal fluid for laboratory testing. Spinal fluid is removed using a small needle inserted between two bones in the lower back. The spinal fluid appears typical in people with ALS, but may uncover another cause of symptoms. Muscle biopsy. If your healthcare provider believes you may have a muscle disease rather than ALS, you might undergo a muscle biopsy. While you're under local anesthesia, a small piece of muscle is removed and sent to a lab for analysis. Nerve biopsy. If your healthcare provider believes you may have a nerve disease rather than ALS, you might undergo a nerve biopsy. While you're under local anesthesia, a small piece of nerve is removed and sent to a lab for analysis. MRI treatments can't reverse the damage of ALS, but they can slow the progression of symptoms. They also can help prevent complications and make you more comfortable and independent. You might need a team of healthcare providers and doctors trained in many areas to provide your care. The team works together to prolong your survival and improve your quality of life. Your team also may include physical therapists who can help with mobility and safety, occupational therapists who help people with ALS learn how to use adaptive equipment, speech therapists trained to help people with ALS who have trouble swallowing or who need speech-generating devices, respiratory therapists, nutrition specialists, also known as dietitians, nurse coordinators, social workers, sleep specialists, representatives from the ALS Association to connect families with support groups and other resources. Each member of your care team brings knowledge and expertise to your care, which benefits you. The average life expectancy for people with amyotrophic lateral sclerosis, ALS, is 2 to 5 years after diagnosis, but some people live much longer. 50% live at least 3 years after diagnosis. 25% live 5 years or more. 10% live more than 10 years. 5% live 20 years or longer. Survival beyond 20 years is rare. Factors that may contribute to a more favorable survival rate include younger age, male gender, and limb rather than bulbar symptom onset. The most common cause of death for people with ALS is breathing failure. ALS is a fatal disease, and there is currently no cure. However, there are things you can do to slow the progression of the disease and improve your quality of life, such as working with a healthcare team, making dietary changes. Some top facilities for amyotrophic lateral sclerosis, ALS, include Mayo Clinic, has campuses in Arizona, Florida, and Minnesota that are certified treatment centers of excellence by the ALS Association. Johns Hopkins Neurology, a global leader in ALS research, with the Robert Packard Center for ALS Research, dedicated to solving ALS. Swift Institute Neurology in Reno and Nevada facility with over 60 specialists, including neurologists, neurosurgeons, and spine specialists. Other ALS clinics and centers includes the Center for Restorative Neurology at Loma Linda University Neurology, the Center for ALS Care at Cedars, Sinai Medical Center, and the ALS Research and Treatment Center at UCSF. You can also use the IMALS tool to find an ALS clinic near you. Enter your city, state, or zip code into the search bar to see a map of nearby clinics. Most people with ALS receive care at home from loved ones, but other options include home care agencies, assisted living facilities, group homes, skilled facilities with 24/7 care, and long-term care facilities.